In public health, we mention the main goals of public health is to improve the health status of the population by the promotion, protection, and the prevention of diseases. And in order to protect and to know the health status of the population or to improve the health status of the population, we need information to know what is the component of our community, what are the health problems in the community, what is the mortality or different causes of death, and what are the different causes of diseases in the morbidity in the community, in order to know what are the main health problem, and we need to prevent it and promote the health of the people and protect them. And also it is important to know what are the health services or the programs which are rendered to the community, in order to see what are the needs or what are the gaps in these health services, in order to improve these health care services. So we need information to have this to achieve these goals. So, what are the health information system? The health information system, it is an information which are gathered and retrieved, processed, and stored in and disseminate information to support the activities of the health system in the planning and control and coordination of the decision making and help in the management of the services. So it is a group of information, or they are informations which are taken from different health services, and then we are going to take this information, and we are going to process it and analyze it, and in order to change it into important information. So we are going to gather information from different health institutions in order to have information about these health services. So, as we mentioned previously, in the public health or epidemiology, it is a quantitative discipline or science dealing with numbers, and then we are transforming or changing these numbers into important information. And so it is important information which are needed to know the health status, health problems, mortality, death, morbidity, and the rendered quality of the rendered healthcare services, in order to know the needs, in order to know the gaps in these healthcare services, in order to improve these health services. So the ultimate objectives of health information system is not only to obtain information, but also to improve actions by taking this information and transforming it into useful information, in order to be helpful or and used by the decision maker in order to improve the health programs. So it is important, the information, they are important information which are used to measure the health status of the community, and we have discussed the different rates which are used to assess the fertility of the people, how many babies born every year, what are the number of women in the community. So it is important to provide them with appropriate healthcare services for the children and for the mothers. What are the health problems? What are the causes of diseases in the community? What are the causes of death in the population? So it is important to have this information to know or to assess the health status of the population. Also, as you mentioned, it is important to know what are the health problems, what are the medical and healthcare services, or what are the needs of the population, in order to provide them with appropriate healthcare services. Also, it is important to compare the health status of the people in different countries between different. So we make comparison between different countries, and also it is important to make comparison in the same country itself by having this information or assessing the health status to see if there are different in the health problem in the, for example, in the urban area than the rural area, for example. Or we are going to make a national and international comparison by comparing the rates which we have already discussed between these different places and different countries. Also, it is important for the planning of appropriate healthcare services by having this by evaluation of different health care services in order to see, as we mentioned, what are the gaps, what are the resources rendered, and what are the sources needed in order to improve the healthcare services. Also, it is important for research into the community to see what are the health problems in the community by detecting what are the risk factors by performing different studies to see what are the risk factor in these communities, and it is important to modify the risk factor in order to prevent the occurrence of disease by different levels of preventions which we have already mentioned by the primary or by the secondary prevention in order to screen for different health problem and prevent the progression of the disease in order to change the prognosis of the disease. So all these are performed by different research in the community to know what are the risk factors, what are the health problems in order to modify these risk factor and prevent health problems. Also, it is important to assess the user's satisfaction or client satisfaction. The people who use the healthcare services, are they satisfied in this healthcare services? And it is regarded as one of the important indicator for the quality of the healthcare services. If there is satisfaction, high satisfaction of the consumer or the user of the healthcare services, that means that we have a good healthcare services. Also, it is important to evaluate some programs which are rendered to the population, as we mentioned. For example, we have large number of programs such as antenatal care services for the mother, and the immunization program, which is called the expanded immunization program. It is important to evaluate these health program to know what is the coverage rate of this program, and what are the people who are not using this program, which is called defaulters, because they are the important people which we have to concern about them. Because if they, for example, if we have children who are defaulters or they don't have the vaccinations, so they will act as a source of infection because they are susceptible because of lack vaccination, and we will have epidemics from now and then. So it is important to detect these people who are not vaccinated, or women who are not using, for example, the antenatal care, because they are at risk of different health problems during pregnancy. So the information used are for the following, as we mentioned, in summarization or in summary, they are important for better management, assess coverage, as we mentioned, and the quality of the service, the cost and the expenditure of the healthcare services, detect and control emerging and endemic health problems. It is important to see what are the emerging infection, such as what are we having now, the COVID-19 epidemic, which is a pandemic now become, and it is important to know what are the sources of infection, what are the main control measures in order to stop this pandemic. Also, it is important to monitor the end progress, the goals toward the goals which we have planned in order to achieve these goals for planning good health services. So there in each country there are special goals according to the type of the population. Some, for example, for developing countries, the most important goal are prevention of infectious health problem, or the decrease in infant mortality rate, improve maternal and child health services. While in other countries, in the developed countries, they are more likely to concern about the non-communicable health problems because of the increase in the rate of these non-communicable diseases. So it is important to monitor the progress in goals, or the health goals, and as we mentioned, there is variation in goals according to the health status of the population. Also, there are what is called the international goals, which is the Millennium Developmental Goals, which are they are 8 goals applied by the WHO, by the World Health Organization, and it is important to achieve these goals, which and they are 8 goals. The first one is the eradication of poverty and hunger, and also they are concentrating about the health status of the children and mother, and we are going to discuss this subject later. Also, it is important to promote equity. One of the important goals of public health is to decrease health disparity, and it is important to achieve health equity. And this means that it is important that all the people have equal level of health. All people have equal level of healthcare services. So it is important to achieve health equity and decrease the health disparity. What are the sources of health information system? First, we are going to discuss this individually. So the most important sources of health information are census, vital statistics, which include births, deaths, marriage, and divorce, demographic information, include age, sex, education, socioeconomic condition, occupations, and also notification of disease. Health institutions and organization, different institutions or health organization, public hospital, private sector, WHO, or different non-governmental organizations. Epidemiological studies, different type of different epidemiological studies, also population survey or household survey, and research. Census, it is an important source of information, which is a periodic information, or periodic survey, which is done periodically every 10 years in each country to know or to gather information about the population as a whole. So it is important source of information, complete count of the country population, take into and periodically every 10 years, and it has or have different information about social, demographic, and health related factors. It is the biggest source of comprehensive data on demography, economic activity of the people, literacy and education, housing and household facilities, urbanization, fertility and mortality, language and religion, and migrations. There are certain importance, for example, strength, and there are certain limitations. For example, the strength of this census is that it covers all the population and different geographical units. Equity of information, the same information should be taken from the population. Also, the data on mortality and fertility for different levels of geographic area, and it has regarded as a source of planning and implementation of various activities and programs for the smallest geographical area. So it gathers information about the population as a whole, but it has certain limitation, such as the two types of error, which include coverage and the content error. Also, although we have a group who they should be trained in order to have the same level, the same types of information, but sometimes there are defect in the coverage and content error. Sometimes, for example, some people they are not available at the time of taking information, so there will be inadequacy or there are some it is incomplete information, or sometimes the content is variable because there are different people, so there is variation in those in those people who are collecting the information, which caused content error. So the information may be incomplete or it is incorrect. Also, there is age misreporting. Some people they don't have the exact age for those people, so it give incorrect information about age. Also, there is no direct questions of death. Sometimes it is difficult to ask about people about on the death or the cause of death, or sometimes the people they don't know the cause of death of their of their relatives, especially for those who are of low socioeconomic or low education. Unable to give the demographic estimate for the period between two census because it is done only every 10 years, which is not enough to see what is the difference in the demography, especially in the population pyramid. So sometimes it is difficult to take the difference or the changes in the population and in the population pyramid. Registration of vital statistics. Events and statistics, which include births, deaths, marriage, and divorce. It keeps continuous check on demographic changes, and if registration of vital event is complete and accurate, it can serve as a reliable source of information. In the developed countries, they have complete and accurate source of information and reliable, but this is still a problem in the developing countries. Preparing health indicators such as infant mortality rates, neonatal mortality rates, and the postnatal mortality rate, maternal. So it has the death reportation or death records is a good source of the different causes of death at different age groups. Also, it is important source for maternal and child health services for planning and evaluation. Also, it is important source of fertility data, and especially fertility data and family planning, such as birth, death, marriage, and divorce. Another important source is the notification of disease. There are historically there the first starting point of the epidemiology or public health is the registration of communicable diseases. They were only concerned about the infectious diseases. It was the first health concern in the past, and still it is regarded as one of the important health problems. The primary purpose of notification is to effect prevention and control of disease. There are special notification diseases center. For example, there are tuberculosis center, or there is, for example, AIDS center, or AIDS HIV program. There are special program, for example, malaria program, especially in the endemic area, or Leishmania center. So there are different centers specialized for certain communicable diseases in order to notify for these infectious or infection or infectious health problem. And the main purpose is for the prevention and control of disease by providing different programs, vaccination, in order to prevent these health problems. It is a valuable source of morbidity data. It records the incidence and distribution of specific diseases. There are certain areas which are endemic for certain diseases, so it is regarded as a source of morbidity information. There are large number of notifiable diseases, such as, for example, in the endemic area, cholera, plague, yellow fever, relapsing fever, according to the type of the country. For example, in developing countries where these infections are endemic or recurrent, so it is important to have special centers for these infections. The most important of this information from the notification center is to provide information and fluctuation in the disease frequency. They register the occurrence of different epidemic, they register number of cases, the fluctuation of the occurrence of this disease, and it also provide early warning about a new occurrence of the outbreaks of diseases. And also the concept of notification has been extended to many non-communicable, not only the communicable diseases. There are special center in order to improve the health status of the population by promotion and the prevention, also the non-communicable diseases such as cancer or congenital malformation or mental illness, stroke, and handicapped person. So especially in the developed country, there are large number of the non-communicable disease center to prevent the occurrence of these malformation, congenital malformation, or mental illness or handicapped person. While the limitation of the notification centers, the notification cover only small part of total sickness in the community, because the communicable infection or diseases, it constitute only part of the health problem in the community. So it covers only the small morbidity in the community or sickness in the population. Also, sometimes the system suffer from under reporting, and especially for those people, or there are missing cases, especially for those people who do not consult healthcare services, or sometimes they die before they consult the healthcare services, so there is under reporting. Also, there are atypical or subclinical cases which they are not notified or they are not registered, especially those individuals who there are group of people who carry the infection and transmit the infection to others, but they don't have sign and symptom, which they are called chronic carrier, such as in typhoid fever, for example, or for example in a large number of diseases which where the people they transmit the infection, but they are not showing sign and symptoms. The health institutions and organization, there are large number of hospitals, health centers, different types of health centers which are provided, and the private hospital, for example, private clinics. There are different health institutions which provide large number or huge number of informations. For example, the hospital records. Hospital records, they are records which are available, and they are huge, which give huge information or large information about the geographical source of patient, from where the patient come, by asking about they are asking about the geographical area or the residency of different people or place of residency, so they know what are the area which are more likely to have the disease, for example. Also, it shows the age and sex distribution of the different types of diseases, and also it gives information about the duration of hospital stay, because this is very important for the planning of the healthcare services. It is important to know the average number of days for each diseases, which is variable from one disease to another, and this is important in the planning of the healthcare services. Also, it is important in giving the distribution of, as we mentioned, different diagnoses. Also, association between different diseases. Some people, they are admitted with multiple diseases, or what is called the comorbidity, and it is important to know the association of multiple health problems which occur sometimes all together, especially among elderly people. The period between, also it is important to know the period between disease and hospital admission. Some people, what is the gap or the period or the time between when the individual have the disease and when the individual admitted to the hospital? It is important, for example, especially for the infectious disease, to know who are the people maybe in contact with this individual before they are admitted to hospital. Or it is important to know the incubation period of certain diseases, for example, or what is the natural history of the disease by estimation the number of the days before having the serious illness and the symptoms. Also, the distribution of patients according to different social and biological characteristics. What are the some people usually as in public hospital, usually most of the it should be used by all the people, but in some cases it is more likely to be used by the individuals who are from low or from intermediate socio-economic condition, because they are unable to pay for the private care. Also, it is important to give the cost of hospital care. In there is variation about the hospital or public hospital in different countries. Some countries it is provided free for all the people, but some people depend on for example, on insurance, on the insurance of the people, health insurance of the people. So there are different differences, or there are variation in the cost of hospital and different health services provided for the people. The drawback for or the disadvantage of the hospital information, they are large number, huge information, but it represent only the tip of the iceberg, which we have already discussed. Only the severe cases they come and consult or admitted to the hospital. So it represent only the severe cases where there are large number of people who may have this disease or different type of disease, but they don't consult the hospital because of certain causes which we have already mentioned, which is either self-limited disease or self-administration of certain medication, or sometimes death. Some people die before they admit to the hospital. So it does not represent the real number of diseases or morbidity, because it represents only the severe cases, or it represents only the tip of the iceberg. So it is not representative for the all population. Admission policy varies from hospital to hospital. There are different rules or policies for admission, and this is variable from one hospital to another hospital, from one country to another country. As we mentioned, there are different protocols. There are different guidelines in different hospital. So there is variation in admission policy. Some hospital they have certain protocols for admission. or certain policies for admission, and this is depend on the national state or on national laws. There are no precise boundaries to the catchment area of the hospital. Some there should be. In the well-developed countries, there are hospitals for each geographical area. So each hospital cover a certain geographical area, and all the hospital they should have the same level of health services in order, as we mentioned, to for the provision of what is called the health equity. But this is not always the case. So the some hospitals in certain or main governorate or main cities, they are different in the quality and the services which are rendered in the for the people. So there are different hospitals, different health services to cover each health to some geographical area. So some people they go or they consult or use other hospitals in other geographical area rather than in their geographical area because the variation in the level of the health services rendered. So, although there should be hospital in a geographical area, but some people they go and consult for other geographical area. Population served by hospital, there are variation in the population who are using this healthcare service or this hospital. In rural area there are the people different from the hospital in the urban area. So the people using the healthcare services also it is variable from one area to another area. The disease registers or registration. There are specialized center in order to provide or provision for the provision of health services for special diseases. For example, we have in Jordan the National Cancer Center, Al Hussein Cancer Center, and the National Diabetes Center, and they are providing healthcare services for people with cancer and for diabetes. These are special health centers for the provision of health services for special diseases in order to take care of these diseases, to have full registration and follow up and provision of continuous count and the frequency of this disease and the quality of the health services provided for this healthcare health to this patient. So it describes the natural course of the disease, especially the chronic diseases in different parts of the world. So they are important source of information about different health problems. The importance of these health centers, they used for service management, for a good management for these health problem. Yes, yearly data on the service are, or sometimes they perform evaluation for this health services either yearly, every year, every month, every week, according to the to know the this they always they process the information every month, every year in order to keep this registration. It is regarded as basis for disease surveillance system to detect outbreaks sometimes. Also useful in the measuring the performance or facilities and monitoring of the health services provided for these patients, and by monitoring also generate data on a state specific scheme for local planning and surveillance. The limitation to exclude those not accessing the services. So it is provided for individuals who have an access to this health center, for to this center, specialized center, but some people may consult other centers. So it does not also give the information, for example, full information or full registry on cancer, because many people may use other center, for example private centers or private clinics, in order to have the care. So sometimes it is also it is not give it excludes some people from accessing this service also. Sorry, the problem, sometimes they make exclusion for those who are not accessing the service. So it does not represent all the information about the disease. Incompleteness and data quality, reporting problem and irregularity and data duplication and inconsistency. And the private sector, often they are not included, as we mentioned. The epidemiological surveillance, the surveillance system are often set up in case where a disease is endemic. For example, in malaria, tuberculosis, leprosy, or large number of certain diseases, it is important to report these diseases, and also to know the result or effort which used for the control of these diseases. These programs have yielded considerable morbidity and mortality data for specific diseases. Environmental health data. There are, we mentioned that the effect, the environmental factor, which could be physical factor such as air, water, noise, and radiation, or pollution, and also biological, such as different microorganisms, chemicals, different chemicals which affect the health of people, or industrial toxicants. So this all these factors which may come from inadequate waste disposal and other aspect of the combination of population explosion and increased production or consumption of material or good. So environmental data can be helpful in the identification and quantification of factors which are causative of disease. So this information about the environmental factor, or the factors which environmental factor which affect the health of the people, it is regarded as important source of information in order to detect the causes of diseases. Population survey, household survey. This is very important source of information, because we are going to go to the people at their home, and we are going to collect information from the people. So a health information system should be population based, from the people themselves. This is routine statistics collected from the above sources. Do not the routine statistics which are provided from the previous do not provide all the information about the health and the disease in the community. So the term health survey is used for surveys relating to any aspect of health, morbidity, mortality, or nutritional status. Special surveys, for example, we want to assess the nutritional status of children. So we are going to perform what is called the household survey. We are going to look for the children who have or assess their nutritional status, and we are going to examine them at their home. And we are going to, it is important to include large number of samples from the people, large number of children in the population, in order to assess, for example, the nutritional health status or any health problem in the community. So we are going to the people at their home, assessing the nutritional status of the children by having information about these children, measuring the health status or the nutritional status of the children. We see or measure the growth regarding the height, weight, for example, in children, the head circumference, and we are going to assess the nutritional status. It is important, the health survey or the household survey, it can be representative to larger number of the population, especially if we have appropriate sampling procedure, if we have a proper sample size, for example, and it is representative to the population. It represents the heterogeneity of the population regarding the living condition, the socio-economic condition. You are going to see what the variations in the population regarding their living condition, regarding socio-economic condition. What is the health status of the population, fertility, mortality, and morbidity according to the subject which you are going to measure or assess. But the drawback of this household survey, sometimes there are what is called also some respondent, they give inaccurate information, or the what is called the response error. They are not responding. The non-response problem, which is one of the important problem. When we ask about certain information, some people they do not respond, or they give incorrect information about the question, or they give incomplete information. And it is time consuming and costly, because we need a team who they should be trained, and this is costly and time consuming. And also it represents the current or temporary situation, but it depends on the questions which we are going to ask, whether retrospective problem or current health problem. So it is important to know what is the goal or what is the aim when you are asking any question. The computerization and healthcare services or information. By the increasing in the technology all over the world, so it is important to use the technology in reporting and keeping the health information, and that's by the introduction of the computer in different health institutions. By time, it is increasing and it replacing the hard copy or the files or the papers by keeping the information on files or patient notes. So by increasing or the updating in the technology all over the world, so they introduce or provide the computer for reporting or registration of different health problem, or the patient's record, they are kept on computer rather than the file or the hard copies. So most clinical facilities are looking towards achieving seamless integration of service based on clinical intranet and the deployment of full electronic records. There are many hospitals which are using the computer and reporting of patients' record. It replaced, as we mentioned, the hard record, and it is many hospital now. There is intranet, and there are good integration and communication between different departments, and the communication between different specialties regarding one patient. So these developments open a wealth of opportunities and promise benefits. However, they bring up them several important concern and risks. So it have also advantage and disadvantage, especially regarding the security issues and what is called the confidentiality, keeping the information confidential of different patients. So but by the computer it is accessible to everybody, but to decrease this problem is by limitation the use of the computer only to authorized individuals, only individuals who are concerning about the treatment of the individual. So it is important to be confidential and keep the secret of the patient by make the access to the computer only by authorized individuals. So computerized and hard copy information differ in two fundamental ways. One difference relates to the perception, that The hard copy is some things we are all familiar with and feel that we understand. By keeping the notes of the patients or by no, by the having a file for each patient and eating and writing the notes of on these notes by the doctors, by the nursing staff, by the physiotherapist, by the pharmacist. It is easier to write on the notes immediately, and most of the health provider, they are familiar with it and they understand. By contrast, information that is stored in electronic or on the computer form is mysterious and therefore a source of anxiety. Some of doctors or some of the staff, they have some problem in using the computer. When it first introduced in some countries, it caused what is called computer phobia, for especially for those old doctors who they have a problem in using the computer. But it is now easier for junior doctors who it is very simple because of they are familiar with using the computer. So it sometimes it cause an anxiety, or sometimes it cause what is called resistance for this change. Some old physician, they don't want to use the computer and they resist the change, or the change in the use of the than the using the hard copy or the files. Professionals and the public are more concerned about the security of electronic records, as we mentioned, especially not knowing where they are stored or who control them. So it may be accessible for many people who are dealing or using the computer, or they are working at the IT in hospital. So it is important to be very confidential, and it should be used, as we mentioned, only by authorized who individuals who are dealing with the treatment of the patient. This may lead to failure of computerized systems. Some people, they have the concept that they feel insecure, and it is accessible for many people and it is not confidential. So the most important aspect in the information, to have good information. It is important to have good information in order to be used for the assessment and for the planning of a good healthcare services. So what are the criteria of the information which we need? First, it should be accurate. Is there any incorrect value in the information? Is it accurate? Is the information is correct, which is given by the people or by different institutions? Is it correct and it reflects the actual status of the people? Is it complete? We mentioned that there are large number of source of information which give incomplete information, and it is important to be sure that it is complete. Constant, is it accurate? Is it agree with the real or actual situation? Timely, it doesn't reflect the need of the population. Unique, is each transaction and even represented only once in the information. All the information should be unique by all health center, all hospital, all doctors at the same time. Difficulties in managing data. Amount of the data increase exceptionally. One of the problem in managing the health information is we have large number of information. We have large number of data from different collected from different individuals. They are collected from different institutions. So there is variation in this information. Data security, the quality and the integrity are critical always. So these are important causes of the when the source of the information is incorrect or incomplete, and this is one of the most important problem in the health information provided by health institutions or healthcare services: incorrect or incomplete. There are always missing some of the information, and this lead to misinterpretation of the data. An ever increasing amount of data needs to be considered in making organizational decision. It is important to have a good organized information, constant information, unique information, accurate information, complete information in order to have a good assessment of the health status, a good assessment of the health information in order for the provision of appropriate, relevant, efficient healthcare services. And thank you.